So I have now the pleasure to present to you this project, which is an international project. I also focus on the loss of function, GRIN variants, and it is probably complementary to what you have heard earlier and, well, I guess also this morning. So this project has been a nice adventure in the end. We participate to a call by the EpiPermed, which is an European initiative for personalized medicine, with the aim to basically confirm precision medicine strategies for rare diseases and validate biomarker of efficacy. So that was the overall purpose of this call. And so then we came out with this project, which is called TAP GRIN, focusing on a tailored approach targeting the underlying pathophysiological mechanism in GRIN neurodevelopmental disorders. So this is the team, the consortium. Myself and the team from Meyer, some of them are here today. And then we have Eleni Panagiotikaki, who I think is also here, with Gaëtan Lesca from Lyon. Then we have Gaia Novarino from the preclinical part from Austria. And then we have Vincent Chatin, who may be here as well, I don't know, from a patient advocacy group, Eureka, again from France. And then we have Professor Jowiak from Warsaw in Poland. So our starting point is, of course, GRIN neurodevelopmental disorders, which we have heard already in a nice talk earlier, how variable can be, how many symptoms they can include. And we know that one of the main starting points for us in order to understand better what gets wrong in the neurodevelopment is to understand the functional effect. And I'm sure you have discussed this a lot, but we need to know whether the variant has a predominant loss of function, gain of function, or sometimes an effect that is not really clear. So within this high complexity, what we had in mind was, okay, there's been nice studies, again, you heard this in the earlier presentation, that show that L-Serine can be effective in people with loss of function variant. Okay, that was the starting point, and the recent studies have nicely demonstrated that. But there is a problem, and this is unfortunately a common problem with rare disease. With rare disease, it's difficult to arrive to high-level evidence because you don't have enough sample, enough people to include in your trial. And second, there is this very high variability. And in fact, we know from our clinical experience that even if we have a patient with a loss of function variant, they do not always respond to L-Serine. And why is that? So that was our, let's say, starting question. And of course, one reason may be that that's not enough. One reason may be that perhaps the effect of the rest of the genome may also play a role. But anyway, we're starting from the evidence of Serine being able to potentiate the function of the receptors, of the MDA receptor, and we know that the MDA receptor do not work well when there is a loss of function variant. And I think also studies from other conditions, such as cognitive impairment, schizophrenia, has shown that Serine can really have a significant clinical effect of enhancing cognitive and behavioral function in patients with also other conditions. So then we arrived to this study where basically we wanted to validate some biomarker. What is a biomarker? A biomarker is a measure of effect. And this biomarker can be at the preclinical level, so for example using models, and also at the clinical level, and we included both. So in order to circumnavigate the problem of doing a trial, like a randomized controlled trial, which would require a high number of patients and should also try to, let's say, mitigate the variability, we decided to adopt this relatively new approach, which is a single patient trial, or N-of-1 trial. What does that mean? That means that basically each patient as a treatment, but then also becomes a control of themselves, because then can also stay without treatment for a period, of course, if that's considered safe. And then in the meantime, in this process of having the treatment and not having the treatment, we want to see what are a potential predictor of response to that treatment. So that's our design, in very simple words, for this study. And so our aim will be then to try to understand who may benefit significantly from L-Serine and who may not. And so then it will become very important to explore all the other strategies that are already in the pipeline. So we have different work packages as part of this project. So we will start from the clinical part. So each country, we will include patients where a loss of function effect has been demonstrated. So definitely we have to have a confirmation of a loss of function. And then this patient, we will be studied very closely for a number of factors. So of course, seizure control, but we will also include people without epilepsy. So we will then measure cognitive function, behavioral function, neurophysiological response, and I will show you in a second what I mean by that. But also, for a subset of this patient, we will take a blood sample from which we will generate models. So we will generate cellular models, 2D and 3D, and we will measure also the effect at the cellular level to see whether there is a correspondence and to better understand the mechanism that may be associated with response or lack of response. And then, of course, we will try to put all this together and try to see whether we can really individualize also within the loss of function people that we know still are quite variable in terms of presentation. We will try to see whether we can predict who will respond and who will not. So this is how the single patient trial works. Basically, every participant will have at least 2 cycles, and 1 cycle lasts for 6 months, and they will be randomized to 3 months of treatment and 3 months of placebo. And of course, then we have developed an algorithm to randomize completely and do this in blind, because of course we want to really enhance the robustness of these findings. And then we will see this patient every 3 months to monitor all the different variables we are interested in. So what are the biomarkers we want to look at? Well, first of all, we want to look at all the neurodevelopmental outcomes, so cognitive function, behavior, seizure control in the people who have epilepsy, motor function, and sleep. But also, we want to add another layer that is more at the system level, which is given by neurophysiological examination. What are those? So, well, we will include EEG, that I guess all you know what that is, and transcranial magnetic stimulation, TMS. And I will also explain that in a minute. And then, at the preclinical level, we will generate these 2D and 3D neuronal models. We will also give us a measure of the effect at the cellular level. So this is just a sort of parenthesis from our center. So just after we received the funding, it took some time to set up the project, and I think all my colleagues will confirm the same, for the ethics approval, for the setup of the infrastructure and so on. But now we have started. We have already identified 80 patients just with GRIN variant, with a very variable age range, although we include people up to 30 years of age in the project. So we have, of course, already characterized from a clinical perspective all the different sort of main clinical symptoms, but also we only considering for this study people with confirmed loss of function effect. Okay. So this is just a stratification of the symptoms prevalence in our larger cohort, so including all the people. And of course, it would be nice to then have additional strategies for those patients where we cannot confirm a definitive loss of function effect for their variants. And so what's the timeline? Well, we start with the screening. I want just to specify that we are also including people who previously had serine. We just need a sort of washout period of 3 weeks. So the fact that they are already on serine is not an exclusion criteria. But then we will screen them for 4 weeks with no intervention, which will serve with a baseline. And then we will randomize the patient and start the treatment. And as I said, this will be randomized to either serine or placebo. And then there is this algorithm about the randomization, because of course we don't want to know who is taking what, and we don't also want to have a specific order that also parents or caregivers will not know, because that will decrease the risk of bias in the reporting of the effect. So this is where we are now. We started a few weeks ago. We were already able to include 6 or now 7 patients, I think. 3 are still in the screening phase, and 3 have already started the investigational product, which could be either serine or placebo. So what each participant does? So, well, of course, we do a very general clinical examination, and then we do a number of cognitive and behavioral tests to analyze motor function. We do the normal standard EEG, ideally including also sleep. Then we do the transcranial magnetic stimulation, which I will show you now, and then we take a blood sample to generate the models. In terms of the test, I won't give now all the details, but we use different validated scales to test cognition and behavior at each time point. We had careful discussion to choose this test because, first of all, we wanted tests that are available in all the countries that we will include, because that's important, so we can put together all the results. And also, we, of course, have to use scales that are validated, and we will also adapt each scale based on the age, because, of course, not all scales are applicable to any age. And also, we avoided those tests who are affected by the fact that they've been done closely, because some tests are affected by repetition effect. But all of this we can repeat within a few months with no significant bias. And finally, I want to show you this transcranial magnetic stimulation, which not all of you may be familiar with. So this is a non-invasive technique, which basically gives a magnetic perturbation, magnetic stimulus, the same that we receive when we have an MRI scan, for example, but it's very circumscribed. But this magnetic input induces an electrical field in the brain, and so elicit a response in the brain. And the response by the brain can be measured at the muscle level. So basically, we stimulated the motor cortex, it goes through the spinal cord, and then we evoked a sort of twitch in the hand muscle that we can measure. And that's here. This is the motor evoked potential, MEP. And we know that this has been linked with specific function in the brain. Even more, I think, sophisticated and informative is what we are doing now when we can couple TMS with the EEG, because with the EEG we record the response from the whole brain cortical structure. And you can see this is a TMS evoked potential, where basically when we then average all the responses, we can nicely see how the brain responds at different time points, and how the response propagates within the brain. And the TMS evoked potential has been used more and more in different neurological conditions, a bit less in epilepsy and in neurodevelopmental disorder in general, but we are now quite regularly using it, and we believe it's giving us very significant information. And I just show you this unpublished preliminary data, which to me looks quite interesting. You can see the difference between the TMS evoked potential from a healthy person and a person with a green loss of function variant. You can see that it's clearly different. It's lower, the response. It comes a bit later. And of course, now what we want to see is whether with the L-Serine treatment, this somehow will normalize to the one of a person without cognitive or behavioral difficulties. So this is the sort of rationale to also include transcranial magnetic stimulation in our assessment. And then finally, the cellular models. I think you may have heard quite a lot. I saw this morning was based mostly on this preclinical model. We will include both the 2 and 3D model to analyze the electrophysiological response of the neuronal model, but also with the 3D models, try to see a bit better at the tissue level what happened, first of all, because of the variant, but then what's the effect of L-Serine, because of course L-Serine will be administered also to the cellular model of the patient to see what's the effect. Because of course, one, as I said at the start, we don't really know whether perhaps L-Serine can be effective just to reverse the problem at the cellular levels, but then, I mean, our brain is so complex that maybe other mechanisms intervene and do not allow a complete restoration of function. Yeah, that's it. So I want to thank all the collaborators in the project, the team here, Giulio Peroni and Daniela Graziani are here from Meyer, and then all the consortium that I introduced earlier, and of course the GRI Italia and GRIN Europe that have been very supportive for this project. Thank you.